Thank you, Mr. Speaker. I give this government credit for making the fentanyl antidote naloxone widely available. However, many Albertans view naloxone as a cure for overdosing on fentanyl when it is not. It simply buys time for a victim to receive life-saving medical care. So with that critical piece of knowledge lacking in the general public, Albertans will continue to die needlessly. So to the Health Minister, given that the grave misunderstanding that naloxone is a cure that can result in death, how are you ensuring Albertans are aware that it is critical for someone who has received naloxone to obtain medical attention as soon as possible? Thank you.
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for asking a question of such importance to Albertans and members on both sides of this House. Certainly, fentanyl is a deadly threat, and we're working through public awareness around making sure that the awareness and the risks are available. Also, harm reduction, which was mentioned, naloxone. Every one of our distributing centres is working with citizens who are getting these kits to explain to them how to use them and to follow up with proper interventions afterwards, Mr. Speaker. So certainly there's lots of community groups helping to distribute these kits to those who most need them, and they're providing the education on the ground, Mr. Speaker.
For supplemental.
Thank you, Mr. Speaker, and thank you, Minister. Given that most addicts are in denial and will not proactively obtain a naloxone kit from a doctor or a pharmacist, and given that family and friends who desperately want to help their loved ones cannot obtain a kit and training unless the addict is with them, and given that this government's naivety of addictive behavior is failing to ensure that everyone who wishes to save the addict's life has the opportunity to do so, why are you not allowing family and friends to obtain naloxone kits upon request?
Minister of Health.
Thank you very much, Mr. Speaker. We're working with evidence to make the best decisions on behalf of citizens, and certainly the evidence has shown that those who self-identify as using, so anyone who self-identifies as having a history of use or having used in the past or currently has access to one of these kits, and we're making them available through a variety of means, including pharmacies. But where we started actually was with the service agencies that are working most closely with the addicts. So, for example, here in Edmonton at Streetworks, a needle exchange program, they're the ones being trained on how to distribute and share the information, and they're doing a great job of getting into the hands of those who most need it, Mr. Speaker. Thank you.
Second supplemental.
Thank you, Mr. Speaker, and thank you, Minister. Given that addicts are solely focused on their next fix and act defensively if someone offers them help, and given that placing the onus on addicts to obtain naloxone reflects a common misconception about a drug addict's typical behavior, will you commit today to let family and friends obtain naloxone kits if their loved ones is resistant to taking that proactive measure? Thank you.
Minister of Health.
Thank you very much, Mr. Speaker, for the question. Certainly any citizen who has a history of use has access to these kits if they express that they've self-identified as being a user having a history of use. So certainly we would encourage people who have that history to disclose that to either a pharmacist, to EMS, to the nurses that are now able, RNs are now able to prescribe the kits as well, or to any of these on-site programs that work with populations who are at risk typically. So we're very proud of that, and we're continuing to work with the fentanyl response team, as well as developing an opioid reduction strategy that will consider expansions to other demographics potentially, but we certainly want to make sure we're using evidence to derive these decisions.
Thank you.